Welcome to eZeLiving.com. I'm Jan Herdman. Today we're talking about scoliosis with Dr. Naveen from the Chiropractic, Physiotherapy and Health Clinic. Welcome, Dr. Naveen.
Thank you, Jan. Thanks for having me.
Okay, so today we're talking about scoliosis. Tell me, can you explain what it is and who gets it?
Scoliosis is curvature of the spine. Usually women get it more than men. There's a ratio of 2 to 1. There's different parts of the world where I've noticed more people get scoliosis, especially in the Middle East.
So what causes it? Is it something that you're born with, or is it something that develops over time?
Scoliosis is caused by there's two different kinds of scoliosis. There's functional and there's structural. Structural is usually caused by genetics, and it's people usually are born with it, and it goes by undetected for so many years till something major happens to the body and puts the body out. Functional happens due to a misuse of the spine, usually in unilateral sports such as golf, tennis, and squash.
So tell me, how is it detected? Is it visible to the naked eye, or do we need to have an X-ray to pick it up?
In most of the cases of scoliosis, to the general person, it's not visible at all. In some severe cases, it is very visible, and you could notice people either limping or kind of walking funny, where they're laying, putting more pressure on one hip than the other, one shoulder is higher than the other. But that's usually in very severe cases. But in most everyday to-day person, they could have scoliosis and not know it.
So how do they treat it? Is it something that can be cured, or is it something that you just have to manage?
A very simple test to detect scoliosis is that you can have the person undress and expose their back and ask the patient or the person you're examining to bend forward and touch their toes. Now, as they bend forward, you will notice something called rib humping. And what that means is that the ribs will start, one part of the rib cage will be higher than the other. In that case, whether it's mild or severe, the person definitely has scoliosis. But still at that point, you can still not diagnose it, and X-ray, full spine X-ray will be needed.
Okay, so then how do you treat it? Do you need massage? Do you need chiropractic? What do you need?
If it's not a very, we talked about there's two different kinds of scoliosis. So we're going to first talk about functional scoliosis, which is something that happened over time due to misuse of biomechanics of the spine. That is very easily treated. Within 6 months, the person could go back having perfect spine posture. And the main ways to treat that is two main ways. Is basically building your core. So that would be seeing a physiotherapist and a physical therapist, and seeing a chiropractor and osteopath to align the spine in the proper way. And regarding structural scoliosis, which is, again, as we said, you're born with it, with that, there's really not much we can do to, it's irreversible, we cannot reverse it, but what we can do is prevent it from getting worse. And that way what we could do is, again, the same thing is seeing your chiropractor or osteopath and seeing a physical therapist, because there's two components to it. When there's scoliosis, there's a muscular imbalance and there's a spinal imbalance that needs to be addressed.
Thank you. So if it's not treated, does that mean that it becomes more degenerative?
Over time, the spine, with all the stress of our day-to-day life, the spine does kind of get a lot of axial loading and a lot of pressure. So if the spine is not straight, not exactly straight, but not in the proper alignment that it should be, and there's a curvature, it will definitely put you in a very weak position where you could be prone to injuries. So if untreated, so over time you can get in more pain, and especially in women when they decide to get pregnant. I've noticed a lot of women get a lot of pain in pregnancy because they did not know they had scoliosis before getting pregnant.
Thanks, Dr. Naveen. That was really informative. And if you have any questions or comments, then please leave them below, and we'll see you next time.